The human body is fascinating. Covering all of our muscles in the body is this thin little flimsy white tissue called fascia. And if you want to see what that looks like, and you're not a surgeon, the next time you prepare grilled chicken breast, look at that little sheen on the surface of the chicken breast, that little white flimsy kind of tissue. And if you're careful and you pay attention, it's kind of tough to cut through that sometimes. In fact, sometimes you can't even cut through it. You kind of have to tear through it. That little tissue can be very strong. That's fascia. That's fascia. That's what it looks like in us. We have that same tiny, thin, almost transparent film of tissue over our muscles. Imagine you try to put an implant under that thin, flimsy tissue on a chicken breast. It's not going to happen. It's going to be really hard for you to do that. You're either going to tear it or you're not going to be able to dissect it. You're going to go above it or below it and tear it up. That has been my experience when I have seen patients, because as I mentioned, I do a lot of revisions. I've had many, many patients come to me. And when they tell me the surgery they had by the other surgeon, they'll say, oh, the surgeon did a subfascial implant. And when I go in there, it's not subfascial at all. There's no fascia. It's over the muscle. And it's because it's very difficult to get it under the fascia. It's super hard, super hard. Now, I'm not saying it can't be done. I mean, that's where you're talking about maybe a 3-hour surgery. But it is very unlikely. It is very unlikely. I haven't seen anyone that can do it properly and consistently. Having said that, there are some situations where you need, so basically my opinion is it doesn't work. And every patient I've ever seen who's told me that they had a subfascial implant, it's not under the fascia when I go in. It's over the muscle, so it's not under the fascia. And the fascia is torn up. Having said that, there are some very specific cases where, specifically in patients who have had breast cancer and are getting breast reconstruction, where you need to do that for specific reasons, where you don't want to elevate the muscle and you really want to, or they've had complications before and you're trying to repair the muscle, then you have no choice but to try to go subfascial. But it's really hard to get that layer, and I just don't think it works.